Today on Second Opinion with Dr. Ebony Jade Hilton, GLP-1 medications are dominating the conversation around weight loss and diabetes, but are they the miracle drug they're hyped up to be? A former CDC scientist joins us to break down the real pros, cons, risks, and what every patient should know before taking them. Then let's talk about bad breath. It's not just something to be ashamed of or taken lightly. Experts say it could be a warning sign about your overall health, and we'll explain what your mouth may be trying to tell you about your body. And teaching kids early about healthy habits. A new children's book is helping families make brushing and flossing fun while building lifelong oral health routines. All that and more coming up now on Second Opinion with Dr. Ebony Jade Hilton. Stay tuned. Now we're starting with a topic that's not new to our show. A few weeks ago, we spoke to a doctor that was a proponent of GLP-1s. It's a popular new trend to lose weight. And GLP-1, as y'all remember, stands for glucagon-like peptide 1. It is a hormone produced in the gut that regulates blood sugar, it slows digestion, and it signals fullness to the brain. And it was first approved, this class of drugs in 2005 by the U.S. Food and Drug Administration for adults with type 2 diabetes. But now millions of people are using it to actually lose weight. Well, joining me today is Dr. Henrietta Ross. We remember her, the former CDC senior health scientist. Welcome back to the show, Dr. Ross.
Hello. Thank you so much for having me back.
Yeah, listen, we have questions. So do you have any concerns? GLP-1s, like I said, it's been out since 2005. Mm-hmm. But now I think people are starting to hear it on podcasts or seeing it on TV with Serena Williams and celebrities across the board. Do you have any concerns with this class of medications being readily available?
I do. I have a lot of concerns. The main thing is the GLP-1s are for, like you said, those with diabetes, right? So you have this high blood sugar and it's to regulate your blood sugar. The side effect is losing weight. So I take issue and have some concerns about people who are taking Wegovy, who are taking Mounjaro, who are taking Ozempic to lose weight. My concern is you're going to take these drugs that are to lower your blood sugar level, right? You might not have high blood sugar levels. So you're taking these drugs to lose weight, but they're lowering your blood sugar. So what's going to happen then? So now you're going to be suffering from low blood sugar. So that's just as bad and dangerous as having high blood sugar. So that's my issue with that.
Yeah. And if someone is on GLP-1s right now, they're like, wait, whoa, is my sugar high or low? I don't know because I have to check it. What are some of the signs and symptoms that you are having low blood sugars?
Lightheadedness, fainting, extreme thirst, and you can actually end up in the hospital. So low blood sugar is just as bad as high blood sugar. So I think my whole thing with the GLP-1s is, people want to lose weight. You hear about, oh, I'm losing weight. I'm losing all of these pounds and things of that nature. But have you started eating well? Have you started moving your body? Have you started doing those things that you need to do to lose the weight and to ultimately keep it off?
And are you concerned with not only that they're losing weight, is there any concern with how fast people may potentially lose weight? Is there any number that comes off the scale that's, hey, this is too much for it to be gone within a week?
Well, the one thing I will say is it's slow. So it's not fast. You do lose about 1% of your body weight per week, which is the recommended safe way to lose weight. So that I don't take issue with. A lot of people lose about 30 pounds, but it takes them about maybe 3 months, 3.5 months, 4 months to, get that weight off. So averaging about maybe 10 pounds a month, that's fine. That I don't take issue with that part. Like I said, I just take issue with the fact that you're taking this medication, your blood sugar levels are going low. And then my concern is, how long are you going to be on this medication? Because when you reach your goal weight, what's going to happen after you stop taking this medication?
And along those lines, do you think there's any potential risk that this could spin into an eating disorder, of where I've reached my weight goal, but is it enough, right? And we see Ozempic bodies. Can you speak on what's happening in those situations?
So I don't think it'll actually lead to having those type of issues, because one thing about the those GLP-1s, what they actually do is they just slow down the motility. They slow down your muscles with the digestion, so you get fuller quicker, right? So you can eat those bad foods and still lose the weight because you're not over consuming. You're not getting a great deal of calories. And even when you try to stuff yourself, more often than not, people will actually regurgitate because the stomach is full, right? So I don't think that it will cause issues of eating disorders or things of that nature. But I do think that it will cause issues of wanting to just stay on this drug for prolonged periods of time, and then having adverse effects, like we found in some studies that people develop gallstones. Some people develop pancreatitis. So they're developing these issues that they would not have developed had they not introduced this drug into their bodies.
You know, one of the other things I've been seeing is about muscle mass. You spoke about the muscles of the gut and the slowing down of the gut. There's different types of muscles on our body, right? Can you speak on the muscle mass and what impact that may have on long-term health?
So again, the thing of it is that this drug is going into your body, right? And so it's slowing down digestion. You're losing weight. Okay, cool. But the thing of it is, are you working out? Are you going to the gym? Are you eating healthy foods? And that's the problem. People are taking these drugs and not working out. And when you're not working out and you're losing weight and you're not actually working your muscles, that's when you start to lose muscle mass.
And we've read research that GLP-1s can actually have some positive effects, right? Maybe provide protection against some new addictions. Have you heard about this? And
I have. There have been few studies, but there's a study out there that has shown that the GLP-1s help with those who have addictions so they don't worsen, and help with those from getting new addictions. So here's the thing. So in our brain cells, along that, what they call the rewarding pathway, where the dopamine is in our brains, makes us feel happy, makes us feel like, all the joy and things. We have these little receptors that are protein receptors that are there. So they're like little antennas. And so when the GLP-1 is introduced, they kind of put like a covering, a hat per se, on these little antennas. So it stops the cravings and it stops from overindulging. So for those who have substance use disorders, whether it be nicotine, whether it be opioids, whether it be cocaine or even alcohol, don't have that urge to indulge in those drugs or overindulge in those drugs, because of the fact that the GLP-1 is kind of covering those protein receptors that we have in our rewarding pathway. So, I mean, that, of course, is a good thing when you're talking about substance use disorders. And that's something that they found in this one study that was, a great thing about GLP-1s. But I would venture to say that they would probably have to change the formula a little bit to, so it won't be the ones where it's actually lowering the blood level and all of that. So. But yeah, that's a positive thing.
And with us finding that out, right? Like I said, these meds have been out since 2005, but really in the large number that we're seeing it now, it's hitting a lot of different subgroups, right? Do you think there's enough scientific research that has been done on this drug at this point? And if so, why or why not?
So at this point, no, I don't think there's enough research that has been done on what happens after you stop using the drug. There are some studies out there that show that once you stop using the drug, people tend to gain the weight back, right? So I just think that there need to be more studies about what happens after you stop using the drug and what happens if you're on the drug for prolonged periods of times, for years. Because the whole trend is people get on the drug, they use it for 4 to 5 months, and they hit their goal weight, and then they stop.
Right.
So now we need to really, research and model and actually follow those people to see what happens after they stop using those drugs.
Right. And what are the clinical implications? We have what's happening in our homes, and we can see the scale, and we know about the early feeling of fullness. But as an anesthesiologist by trade, right, my thought goes, what happens in the operating room? So what is your concern for people taking GLP-1s if they need any type of medical intervention, any type of medical surgery? What are some potential complications?
So the first thing is, if it's a scheduled surgery, they need to be honest with their providers, because the providers are asking the questions now, are you on any GLP-1s? And they're asking that because they want people to stop taking them a certain amount of time before the procedure. Because again, because it slows digestion, there still can be food sitting in the stomach. I know a lot of times you have to fast, 24 hours prior to your medical procedure, nothing by mouth. But if you're on a GLP-1 and you stop eating 24 hours prior to your surgery, there still can be food sitting in your stomach. Mm-hmm. And during that procedure, you can aspirate, right? And so, of course, that can lead to death. So the first thing is to be open and honest with your physician when you're doing like the pre-surgery workup and everything, to let them know that you are indeed on GLP-1s, to where maybe your fasting you have to stop taking the drug, first of all, at least 2 to 3 weeks prior to you even having the surgery, right? So it's out of your system. And so, you can get back to your natural and your regular digestion, right? So that's the first thing. And then, God forbid, if there's an emergency surgery that has to happen, again, the individual is more likely to aspirate because there is, food sitting in the stomach. So.
Right. And it's one of those things, we have measured. I want people to know, if you come in for emergency surgery, we are ready. As anesthesiologists, we are trained to protect you and your airway, but it does put you at higher risk, as Dr. Ross has stated. So it's definitely one of those things we need to know what you're on. And hey, we can rock and roll with your body as need be. So thank you, Dr. Ross, for coming again to help us separate the excitement from the evidence. You've always been a great guest. Thank you.
Thank you.
And up next, a former owner of a med spa says that she had the weight loss program that clients ignored. But as soon as GLP-1s hit the market, people started flooding her business. Hear why she says it's a designer diet. Stay with us.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
A decade of love, joy, and power. Black Voters Matter is 10 years old, and we are just getting started. This is love with a purpose. This is Black joy in motion. This is unstoppable power. Across campuses, neighborhoods, and back roads. Let's go! We show up not just to vote, but to be seen, to be heard, to belong. We ride together, we organize together. We remind each other that our voices matter, because they always have. Black Voters Matter is about more than ballots. It's about housing and healthcare, clean water and living wages, education, reproductive freedom, and dignity. It's about turning pain into action, turning belief into movement, turning community into power. We don't wait to be invited. We bring the energy. We bring the love. We bring the people. Because when Black communities come together, we don't just survive, we thrive. This is how change happens. This is how history moves. We organize, we build, we win.
Continuing our conversation on GLP-1s, the use of GLP-1 drugs such as Ozempic, Wegovy, Mounjaro have increased dramatically. In fact, between 2019 and 2023, there was an increase of 700% in the prescriptions for it. And that was among the non-diabetics. By 2024, approximately 1 in every 8 U.S. adults reported using a GLP-1 medication. So you can imagine that spending on this drug is not cheap. It's literally in the billions. And joining me now is Kharel Baker, owner of Premier Medical Consulting and a former med spa owner. Welcome, Kharel.
Thank you. Thank you for having me.
Yeah. Now, it says you waited about a year before you started administering GLP-1s in your practice. So why did you wait?
Well, it was a new drug. It was a new revolutionary thing that people were, talking about. And I wanted to make sure it was safe. Anything that you're putting into your body, there wasn't enough information out there. So I wanted to make sure that what I was giving my clients and presenting to them was something that would, not damage them as much as I could, as much as possible.
Right. And when you started administering it, it was still short on the list, right? So compounding pharmacies made their own formulas. And what was that cost per month supply?
So supply per client, it ranged around $400 per month. And that was a that was as low as it can get. Whereas insurance wise, you're looking at $1,500 a month.
Wow. And why does it cost so much? Do we know what's driving this price up?
We have no idea. We still don't have any idea after, 3, 4, 5 years. We still don't know.
Mm-hmm. And is there any concern, when we talk about compounded versions of GLP-1 medications, what does that mean for a patient? If they're now on websites and they say, hey, you can get this pill or you can get this compounded version, should there be something that they're looking out for?
Well, the compounding company needs to be a non-research-based compounding company. And with that, they are pretty much putting together their own formula, which means you want to make sure to check those ingredients, check what the side effects might be with that specific company, and see if anything in there might cause alarm with any other health issues you might be experiencing. So it's going to be you're going to have to be a little bit more meticulous than just trusting and saying, oh, pill, or, oh, I would rather take this as an injection. You want to just make sure that the product that you're taking works and it's effective. And also if it's had any side effects reported at all.
And, many people at this point, I think, are getting their GLP-1s through med spas or online clinics, right? They go to a website. What safeguards should patients look for to ensure that they're actually receiving the medication safely? Like, is there anything that would show them on a label, or how can they check?
Yes. Well, actually, what you want to do is make sure that you are going to a facility where that medication is being sent directly from the pharmacy to your home. You don't want to go into a facility and just trust what they're mixing up because you're not quite sure if the levels of the ingredients are correct. So you want to make sure it's coming from a secured source, that is coming direct from the pharmacy to your home, and that you can administer you can administer at home, and all the things that you're going to need to administer are included.
Now, you mentioned with your med spa that this medication was costing upwards of $400 per month for the supply, and even with insurance up to $1,500, right? Was it in high demand despite that cost? Were people knocking on your door saying, yeah, but I still want it?
Oh, yes. It felt, as soon as we started to offer the GLP-1s, what we noticed was there was a tremendous rush in phone calls, appointments, trying to come in. We had to add 2 additional providers just to see the increase. So we had about an 80% increase in inquiries, 80% increase in our patient load for just the GLP weight loss medications.
And can you describe what type of person was coming into the clinic? What type of, was it older people, younger people? Was it people with diabetes, or was it just people who said, hey, I'm just here for the weight loss?
We had a lot of people that said, I'm just here to look good. I want to lose this weight. I want to feel better. It was not tied to a medical condition, which was kind of interesting because, of course, this medication was made for those who are diabetic primarily. But we saw a lot of especially women coming into the spa looking for that weight loss medication and that weight loss thing that will just finally help them to lose the weight. So we saw a lot of menopausal age women coming into the spa, and they had great results.
And now, do you see that shifting? Do you see more men, for instance? Are men starting to use GLP-1s at equal rates of women?
Absolutely. This is now, GLP-1s is now part of the process of getting, of being an adult, of gaining a few pounds here and there, and definitely wanting to lose that weight. So we are seeing an uptick in men coming in for the service, and they are losing the weight just as well as the women.
Now, prior to the GLP-1s and you using that within your med spa, did you have another weight loss program? And did it do as well as far as people saying, hey, I want to be a part of that program versus this one?
So yes, we did have a more traditional weight loss program in our spa, and it did okay. What we did find is that, people did not want to do that traditional route. They didn't want to diet. They didn't want to exercise. They didn't want to do some of the shifts in behavior in order to lose the weight. So when GLP-1s came, it was a lifesaver for them. They did not have to commit to a lot of the lifestyle changes. So we did see a huge difference in what our clients were signing up for.
And what are your concerns if someone is using the GLP-1s for 5 or 10 years and they're not doing those lifestyle change motions, right? They're not doing the exercising, they're not necessarily changing their diet. What's your concern about that long-term use?
Well, in everything, there's always a few that stray, but we're seeing a huge number of people that use it as a designer diet. And a designer diet meaning, I have a few pounds that I want to get rid of. Let me get on the medication. And then they lose that weight and they come off of it. And then they go back and they come off of it. And they continue that pattern. And that's not healthy because you worry about the long-term issues. You worry about what they're losing, how quick they're losing it. And also you're worrying about the weight gain on top of that's coming back. What's happening there? Is it too much, or is it double or even triple the weight that they started out with? So there's a huge concern for the consumer to use it as I'll just get on it for a few weeks or so until I lose that weight to go on vacation or fit into the stress, and then I'm just going to stop. And that that can wreak havoc on the body.
And earlier you mentioned that your clientele were kind of those perimenopausal, menopausal women. What about the younger age? Are you hearing any trends of this now being such a trendy medication that we're having younger and younger and younger? And how young do you think, in your opinion, is too young to be starting this medication?
Well, I am old school. I always try to push healthy lifestyle and watching what you eat, going on a diet that you understand how to even eat and how to even diet for your body. And yes, we are seeing more and more younger people and on the drugs, on the GLP-1s, and they're gaining and they're losing, and they're gaining and they're losing. So I worry about lifestyle changes that is happening, lifestyle choices, especially at that young age. But definitely wish there would be more promotion of healthy lifestyle living.
That can always be tricky, especially when we're young. We're really impressionable, right? Especially about what are the celebrities doing, and I kind of want to do that too.
Oh,
now,
yes.
Being in the med spa area, that's where women and men are going in because they want to feel their best. They want to look their best. Did you see any patients coming in with what you thought were just unrealistic expectations about not only how quickly they can lose the weight, but how much of the weight would actually come off? And how did you manage those expectations within those consultations?
Absolutely. Part of what we have to do is, of course, when you're on GLP-1s, you do have to monitor. You do have to check in with the clients and just make sure they're doing what they are supposed to do and how they're even feeling. Are they having any reactions? And that's simply because a lot of people do want that weight off, and they will endure feeling sick. They'll endure some of the side effects that they're experiencing and sacrificing that in order to lose the weight. So with that, there are some people that expect, and especially with that, when we're talking about this being $400 and up per month dollar-wise. And for a lot of people, that to find that extra money to put into a diet and commit to that is very hard. So we have to set the expectation, and we try to map it out for each of our clients, and we tell them, hey, if you want to get to goal, this is what we're looking at. This is the level of commitment you're going to need to make. And we let them all know this, if you can't commit to at least 9 months, this might not be the option for you. And we let them know up front because we want to set those expectations early so they understand that we are focused on their health and well-being. They are gonna lose the weight. The weight's going to come up, but let's be responsible and make sure that they have the healthiest outcome possible.
And for those listeners who are listening and said, hey, I just want to lose some weight. Is there ever any age or any size range where you're saying, hey, the GLP-1s are not for you, right? That losing weight with this medication may actually be more harmful for your health because you don't have that much weight to lose. What is that target range?
So at our spa, when I had the spa, it was very much, what are we doing? And for what purpose? And we also go and offer some alternatives to reach those goals. So while some people come in fixated on GLP, that is for total overall weight loss. If someone is within 10 pounds or to their goal weight, they might not need GLP all the way around. They might need it in certain areas, love handles, the little abdomen fluff there. So it might just be spot treatments that's necessary and not GLP. So we try to give healthy alternatives to instead of GLP-1, especially if they're within a certain, pound to goal.
And if there's people that's on GLP-1s now and they're saying, okay, I'm getting near my targeted weight, do you wean off? How does it work to get off of the medication so you don't have to be on it for 10, 20, 15, years?
It is so vital to wean on and wean off. Okay. You cannot stop cold turkey. If you stop cold turkey, your body is going to go into, I call it fat shock, okay? It's going to just, oh no, where did it go? And you're going to, historically, a lot of that weight is gained back when that happens. So it's very important to wean off of it. Yes, you've made a goal, you look great, you feel great, but it's very important to wean off of the medication so that your body can get back to a stable environment where it understands, okay, that was for that time, but now we're functional at this level. So you want to give your body that time to adjust.
Kharel, thank you so much for giving us a behind the scenes look at the business, the demand, and the realities of what GLP-1 medications can actually do to your body. So where can people find you? If they have additional questions, is there any way they can tap into your social media to just look at your posts?
Yes, so we have, you can visit our website at pmdcon.com or Instagram at pmdcon.com. We are there as well.
Well, thank you so much, Kharel.
Thank you.
Thank you.
Thanks for having me.
And still to come, have you ever talked to someone and their breath smells so bad that you had to hold your nose? Well, instead of shaming them, we hope to uncover why. Our next guest will surely help us get to the root of the cause as she introduces us to bad breath Millie. Don't go away.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
Why does it feel like we're going backward? Voting rights under attack, schools stripped of funding, Black history erased. This is the Trump MAGA agenda. They want to take us back. They are redrawing congressional lines in states across the country, deciding who gets power and who gets silenced. We see what this is, a power grab. Virginians won't be fooled. Show up, vote, take back our power. It's a temporary measure that gives the people, not politicians, the final say. Vote yes by April 21st.
Now, we've all been in a situation in which we're talking to someone and their breath has been less than pleasant. But when bad breath lasts longer than that tuna sandwich for lunch or that salmon dinner for dinner, it becomes a health concern. And joining us again on the show is Dr. Joy Fremont, owner of Fremont Dental Orthodontic and Sleep Treatment. Thanks for joining us, Dr. Joy.
Thank you for having me again. Thank you.
Yeah, so we know we had you on last time. We were talking about sleep apnea, right? But now we need to talk about something called halitosis. Can you explain exactly what is chronic bad breath and halitosis? What causes it?
So chronic, that only means sticking around for longer than it should be. Mm-hmm. So chronic bad breath or chronic halitosis is what happens when your breath is still bad after you brush your teeth, use your mouthwash, or use your floss. It's sticking around. There's so many different ways that can be caused, but I will tell you between 80 and 90% of bad breath comes from the mouth. 10% comes from the gut or other issues.
And when you say it comes from the mouth, where in the mouth? Or is it a certain crevice that someone can't get with their toothbrush or their floss?
Primarily it's your tongue. So primarily it's your tongue because when you eat and you drink, it stays on your tongue and then it goes back into your throat. And people just don't clean their tongue properly. Of course, you have bacteria in your mouth if you don't brush and floss properly. That plaque and tartar builds up. People just don't swallow properly. And sometimes they actually just have food stuck in their mouth, like the spinach in between your teeth. You can actually see that. But in the back of your mouth, what we call the vestibule, sometimes food gets trapped there and it stays there, unfortunately, overnight. If you don't brush properly, that food turns into rotted food, hence the bad breath.
And why does it turn bad, right? When we eat the spinach or when we eat, I don't know, just any type of food, it doesn't smell bad then. So what happens within our mouth that causes it to now have this odor?
Well, just imagine if you had a steak or even a fresh plate of greens or whatever, and you leave it outside on the sidewalk for too long, it's going to rot. Mm-hmm. So the mouth is extremely high in temperature. If you leave that there for a long period of time, it's going to rot in your mouth. If you don't floss your teeth, you can brush all day, every day. But if you don't use that string floss and floss between your teeth, that food's going to sit there, it's going to break down and basically rot. So you're walking around all day, every day with rotted food in your mouth.
And are there certain medical conditions like acid reflux, sinus infection, or diabetes that cause people to be more at risk of having chronic bad breath? Even if they have good oral hygiene, they're saying, hey, I floss, I brush. People still tell me that I have a smelly mouth.
Well, you just named the top three. So one thing is acid reflux or GERD, and that's when the actual acids that are responsible for digestion back up into your esophagus, and even some undigested food backs up, and then it comes out of your mouth. So people with acid reflux, a lot of times when they have high anxiety, that acid churns and builds up. And people who on a regular basis just talk in a normal, relaxed settings, they don't have bad breath. As soon as that stress hits them, it becomes an issue. Also diabetes, which is what's called ketones. And you've heard the term ketones lately about the keto diets. So unfortunately, people on keto diets have what we call keto breath, because those ketones have a very distinct kind of sweet, sickly kind of smell to it. And then, of course, stress and high blood pressure, hypertension, because what happens is you take medication that treats these things, but those dry the mouth out. The drier the mouth is, the more likely it is bacteria to stick to your teeth and then cause bad breath.
And we know it's not just a, unpleasant thing. It actually can have some health concerns, right? What happens when we have that untreated oral bacteria in our mouth? Like, what happens to us?
So your body is a system. I tell everybody, one thing happens here can affect this over here. So imagine if you had a lot of tartar and plaque on your teeth and you can actually see it. Each time you're talking and biting and chewing, you're swallowing that bad bacteria. It's going down through your bloodstream. There's a distinct correlation between heart disease, gum disease, and even diabetes. So if you're swallowing all that bad bacteria, it's getting to your bloodstream, that plaque can build up in your bloodstream and cause heart issues that are already there to get even worse. So you have to brush, you have to floss your teeth, and then your health overall just gets better.
And for many of us, we're like, oh gosh, she's talking about it getting in my bloodstream, because we wake up with morning breath, right? You hear people say, oh, that's my morning breath. What's happening at night that makes our breath go from okay to I need to run in there and brush my teeth?
So morning breath is common, but it has to go away. So morning breath happens when, remember I told you the mouth is very, very, very hot. So when you're sleeping, the saliva content goes down. As your body relaxes, so does the salivary glands. And so what happens is you don't have that saliva that's designed to flush all that bacteria away. The drier the mouth is, the worse the bacteria gets. So when the mouth is very dry, it's like a hot oven or a sauna. And most times your mouth is closed. Even if it's open, it's very dry, and that bacteria tends to build up. That's why, unfortunately, some people think, oh, I just brush at night. I don't brush in the morning. You got to get that out of there.
Not brushing in the morning. That is interesting. And, and it brings up the importance of hydration. Drink your water, people. It actually helps you.
You have to hydrate.
And speaking of drinks, are there any concerns that coffee drinkers, right? Are people wake up in the morning and they're like, oh, I have to have my coffee, or drinking coffee all day? Does that, or smokers, do they have any kind of propensity to developing bad breath?
Yes, absolutely. I tell people most adults love a fresh cup of coffee. The coffee you smell in the kitchen that comes out that pot does not smell like the coffee breath you have, okay? And then the smoking, it smells totally different. So what happens is coffee, or the caffeine in the coffee, or even the acid in the coffee and the nicotine, those dry your mouth out because it decreases the amount of salivary flow. I've said it 2 times already. The slower the saliva flows, the drier the mouth is. It tends to enhance the bacteria, and it smells terrible. Coffee in the mouth does not smell anything like coffee in your coffee cup.
And how can people attack their bad breath? If they're listening now and say, okay, I get it. It's bad for me. What can I do at this point? If I'm already brushing and flossing, when do I need to start coming to seek medical help and not trying just home remedies?
So the first thing you have to do is make sure that your oral health is pristine. Brushing is fine, but make sure it's twice a day. Flossing is fine, make sure it's twice a day. But the culprit is that tongue. If you were to stick out your tongue right now, if it's not a solid color pink, that brown bacteria is building up. So you have to scrape your tongue with the regular tongue scraper. Now make sure you understand, all tongue scrapers are not alike. You have to use one that has ridges, something like this, that has the ridges, not that cute silver one that's smooth. That's a squeegee. It just gets it away. Not your toothbrush that just brushes your tongue. A toothbrush is designed for your teeth. You have to have one that has ridges, that actually gets into those deep pits and grooves and scrapes all that away. If you don't do the brushing twice a day, flossing twice a day, and using a tongue scraper, you're bound to have bad breath. And then, like you said earlier, you have to almost overhydrate to make sure your mouth is flushed out.
See, Dr. Freeman, this is why we love you, because you bring the props, because visualization is what saves lives. And, you also bring in a little bit of education on your platforms. You have a character on your social media pages called Bad Breath Billy, right?
Yes. So I have a good friend who brought up Bad Breath Billy. So Bad Breath Billy was somebody who her friend was actually dating. And her girlfriend was like, hey, I have a guy I'm dating whose breath is horrible, but I have no way of knowing how to talk to him. Because bad breath, we laugh about it, we joke about it, but bad breath is not only a dental or health issue, but it's also a social issue that can affect your social life and your relationships. Mm-hmm. And most people who have bad breath don't know they have bad breath because that's your odor, is part of your natural odor. So you don't even smell it. So it's very important to know that if you're in a relationship with somebody and they're backing up or dodging or even avoiding you, it may be your breath, so make sure that you are with someone who could tell you, or your friends, and say, you know what, you might want to get that checked out.
Right. And you mentioned earlier too that, about 80-90% is originating within the mouth. What's the other percentage? The 10 to 20%, is that now a surgical need because it involves your esophagus or your stomach, or what can people do to help mitigate that?
Very rarely will you have to have surgery. You need to make sure that if we can't fix your breath because with the brushing, flossing, and scraping your tongue, and you have to do it at home, I can't go home with you, even though you may want me to. You have to do it at home. And if you're honest with yourself and know that you still have the bad breath, look at what you're eating or drinking. And then if that's still not fixing it, don't have surgery. If you happen to have GERD or acid reflux, go get it checked out. So it's very important to know, go to the dentist at least twice a year, but also get your annual checkups. And in between time, if something's not right, go get it fixed. Medication. I'm not saying stop your medication, but how about you hydrate a little bit more? If it's not fixing it, go to your doctor and let's come up with a plan together of fixing the issue.
And some people may be listening right now and say, okay, she said GERD or reflux. What exactly is that? What does it feel like? What are the symptoms? So they can know. And also, are there any over-the-counter treatments that they can use to help remedy that?
So GERD or reflux is basically when you're eating or drinking something that's causing a trigger. A lot of times it could be something like very high in acid, like tomatoes. Everybody's different. But the actual acid backs back up, not going down, it comes back up through your esophagus and it comes out with that bad smell. And once again, you might not smell it. Sometimes you have a very persistent cough. Sometimes when you're sleeping, you just can't sleep at night. You're uncomfortable, things like that. So basically, sometimes just simple as gas X. But I don't want you to over-treat yourself. Get it treated. A simple 1 or 2 times acid reflux is different. But GERD is, once again, a chronic disease that you have to get treated. So make sure that if you have that issue, if you're uncomfortable, if you're always burping or belching, that may be a sign of GERD.
Mm-hmm. That heartburn, when you get that burning sensation,
yes,
it's really important that you go get checked out, because that acid is actually now impairing your esophagus, and that can turn into cancer, people. It can turn into cancer. So go get checked. And Dr. Fremont, thank you so much for reminding us that bad breath isn't just a social concern, that it can be a signal for our overall health. So where again can people find you and Bad Breath Billy? Because they need
Bad Breath Billy hangs out with me sometimes at MissDrLady.com. And I'm on social media under Miss, that's MISS Dr. Lady. I'm in Atlanta, Fremont Dental. You can come see me anytime. If you even have a question and you're not in Atlanta, go on my social media. That's Instagram, Facebook, and TikTok. Ask me a question. That's me who's answering. So I'll take care of you and Bad Breath Billy or Belisha if that's you.
I know that's right. Well, thank you, Dr. Fremont. Always a good time.
Thank you for having me.
Thank you. And still to come, a new children's book is getting children excited about brushing and flossing. We'll explain next.
MAGA Republicans ended diversity programs, cut funding for Black students, and fired federal employees. And they won't stop there. Now, they've redrawn congressional maps so that they can rig the November elections. But we have the power to stop them. By voting yes for fair elections, we have the final say on who represents us in Congress. This is a temporary measure to restore fairness. They are not backing down, and neither can we. Make a plan to vote by April 21st and vote yes for fair elections.
Now, parents, did you know that about 50% of kids have cavities by the age of 9? It makes it one of the most chronic diseases for children. Well, there's a new children's book on the shelves to help reduce that statistic by urging kiddos to embrace good oral health. The book empowers the kids to focus on those early things, right? Brushing their teeth, flossing, and reducing the issues that lead to childhood oral health disparities. So joining me now is Dr. Kharel Austin. She is a dentist and the host of Let's Talk Smiles podcast and the author of The Adventures of Liz and Abe, Visits to the Dentist. Welcome, Dr. Austin.
Hello. Thank you so much for having me.
Thank you. You know, I love a good children's book. I'm a children's book author myself. So congrats on the book. Can we see it?
Yes. Now, the full disclaimer, the author is Nurse Noel, Anthea Noel, and I'm the dentist featured in the book. And this is The Adventures of Liz and Abe. Go visit to the dentist, yes.
Now, what made you two kind of partner in this then, as a character in the book, to write this book? What was the driver?
Well, we have been friends for 30 years, and on this healthcare journey, educating the general population in the media together for the last 30 years. And Liz and Abe are actually her twin niece and nephew. And she was just inspired watching them grow up. She wrote it when they were about 4 years old. And she wanted to inspire those kids who might be at that age where they're afraid to go to the dentist. And this is the age that parents should start thinking about taking their kids to the dentist. If they haven't had their first checkup by that time, they should. And yesterday I had a 2-year-old come into the office. So the younger you could get them thinking about good oral care, the better.
Yeah. You know, and this book is so timely. Like I said, according to the CDC, 50% of children have cavities in their baby teeth. Yes. Why is that? What's going on?
Yes, well, you know, a lot of it has to do with the parental care of their kids' teeth, putting the kids to bed or the infants to bed with milk or juicy juice to pacify them, you know, giving them sweets, you know, anything to shut the kids up. Parents these days, this new generation of parents will give them whatever. So we just have to be mindful, just like with our own adult teeth, the things that we're giving kids. Now, luckily, kids get a second chance with their adult teeth. But, you know, we want to make sure that they don't have these cavities that can cause pain, that can take them out of school, that can, you know, I've seen kids have to get root canals and crowns. And I was a school dentist my first couple years in New York City when I graduated, and I would take the kids out of their class, and I saw so many cavities and chronic cases of cavities and gum disease that it was just heartbreaking. So the sooner we can get to this issue, the better.
And how soon should it be? Like at what age should parents begin brushing their children's teeth? Should they be flossing? You know, when is it too early or too late?
I mean, right away, you want to take a finger swab. They have these on Amazon and some grocery stores. You want to start wiping the gums of that bacteria as early as possible. Now, as soon as 2 teeth erupt through the gums and they're touching, that's when it's time to start flossing. And they actually have these kids flossers that you can buy, just like we have the adult packages. They have them for kids. And because 2 teeth touch, that's when the bacteria can get between the 2 teeth and cause cavities on this side of the tooth and this side of the tooth. So you want to start flossing your kids as soon as 2 teeth touch. It can happen around the age of 1. So up and down to clean those kids' teeth is what you want to do. I know that's probably shocking for a lot of parents, right?
Oh, you see my eyes right now. My eyes are already big, but I have 8-month-old twins and they have their first little teeth and they are touching at the bottom. So I'm like,
time to floss.
I need to get that flagger out.
Yes.
And what are some of the other biggest mistakes families are making when building those early oral health habits with their kids?
Just like your previous guest talked about, the same things that we do to prevent cavities and gum disease, the kids should have a routine as well. I have a healthy smile workout that I have everyone do, and I'm encouraging families to do it. It's a challenge. And really, on a daily basis, you want to brush for 2 minutes, preferably with an electric toothbrush, and they have them for kids. You want to make sure that you're getting the front surface, the biting surface, and the back surface. You want to make sure that, again, you're flossing between each and every tooth. That's step 2. Step 3, you want to use an alcohol-free mouth rinse. Now, they have the kids' mouth rinses. ACT is one popular one that includes fluoride. And you want to rinse for 30 seconds total. 10 seconds over here, 10 seconds over here, and then take it to the head and make sure you're getting the back of the throat and the tongue, as your previous guest mentioned. And cleaning the tongue, even for kids, is important. That tongue holds a lot of bacteria. And in the challenge, I talk about consistency, just building these healthy habits every single day. There's a lot of cool little apps. If you go to the Apple iStore, the store, you can find apps that will help you be reminded to brush and floss, and cool little games and stuff like that. So if you go to vipsmiles.com/challenge, in your inbox, parents and kids, you will get a video from me that will teach you how to do these things properly.
You know, and while you're talking about this, in my mind, I'm thinking, okay, again, I have my little babies, and I'm trying to prevent them from getting this tooth decay. Is it linked to what they're actually eating? Right now, you know, it's breast milk and it's some solid foods. But is there something in the diet that leads the little baby, to the 4-year-old, to the 9-year-old who has cavities? Is it the drinks? Is it juice? Is it snacks? What should parents be looking out for?
Commonly, it's the sugary drinks, the acidic drinks, just like your previous guest mentioned, and the things that you snack on. So in the book, Nurse Noel talks about, you know, choosing crunchy vegetables as a snack. Carrots, celery. I know it's not sexy for kids. They want the chips and the, you know, all the things. But we gotta, as parents, instill apples, you know, something crunchy that's going to stimulate the flow of saliva, natural sugars. And you can balance that pH off with, you know, neutralizing it with water, just making sure that you are cleaning and making sure that what happens is plaque plus the sugar gives you a plaque attack. And that plaque attack is what really starts to cause the cavities. So you either want to minimize the plaque or you want to minimize the sugars, but you certainly don't want those two things to get together, because it will attack your teeth. And that's how those cavities really start to form. And it doesn't take long for them to happen. Now, the next part of it is making sure that you take your kid to the dentist. And like I said, I had a 2-year-old come in yesterday. She was the most adorable. And when you bring your kids into your visits, parents, that starts to get them acclimated that the dentist isn't a scary thing. In the book, we talk about Liz and Abe being afraid to go to the dentist, and the parents being there to reassure them that it's okay. I'm going to be here to support you. And that's what a lot of people need, because a lot of times when we see the dentist on TV, it's a scary thing. We're always portrayed as as the villain. So it's just getting the mindset that the dentist is, the dentist is the good person to save your teeth and to keep them healthy and strong for a lifetime.
Right, because a healthy mouth is a healthy body. And
absolutely.
You know, there's some parents, I'm assuming, that are saying, hey, I see my child has bad teeth, but these teeth are going to fall out in a year or two anyway. Is that something that they should ignore? Is there any risk of allowing those teeth to decay in the mouth and not going to a dentist?
Yes, the same thing as your previous guest mentioned, the same extreme health risk that can happen with adults can happen to children as well. One famous tragedy that happened with a young, I think he was about 12 years old in Maryland, Diamante Driver, actually lost his life because of an infected molar that he had in his mouth, and he just didn't have the money to get that extracted in time. And, you know, it can be as extreme as a loss of life, and we don't want that. So again, that same bacteria that forms every day, that soft, gooky plaque, goes through the bloodstream, goes through the saliva, and it can attack all your vital organs, and particularly if your kids are diabetic or have any kind of compromised systems, it can really start to affect your total health.
Right. And you bring up a point with naming the little baby, 12 years old, that's a baby, right?
Yeah.
Who passed away, and it's so unfortunate. And we know that there is disparities that exist within our community, right?
Yes.
For families who can't afford dental plans, if they say, if you're a mom or dad, you're listening, you're like, I see my baby, I know they have cavities, I can't afford to go anywhere. Are there any resources available, and where can they go to seek help?
Yes, there are resources. One of the easy ones that I tell everyone is your local dental schools. If you're in a major city, most of our major cities have dental schools where you could go and get low-cost dentistry. And the other options are actually teaching hospitals. If you're in a major city, a lot of hospitals have a dental unit because after we graduate, a lot of times we'll do a residency. So these are graduated dentists who are just honing their skills. In New York City, where I am, there's Harlem Hospital, Bronx, Lebanon, NYU. So Google local teaching hospitals. There are organizations like RAM USA that actually has free dental days across the United States. So if you look up RAM USA, you can find out where the next free dental day, and you don't even have to live in that state. You could go and get free dental care. First come, first serve. You get there at like 5 o'clock in the morning, and you can get your basic care, your basic needs taken care of. And then finally, there is a dental plan that I've been recommending for at least 15 years. It is called Carrington 500. This is a plan that is only $8.95 a month. You could put a family of 4 on the plan, and you can save up to 60% off of your dental care. So something that would normally cost $100 could, go down to $40. So I would recommend that as well. And all of these resources are on my website, letstalksmilespodcast.com.
And this is why, Dr. Austin, why shows like this is so important, because
so important.
You're giving so many facts and resources from, like you said, the medical schools, like you said, the RAM, you said RAMs?
RAM. Mm-hmm.
And how do you spell that out?
RAM, I think it's remote area RAM. What is the M for?
We'll find out.
Medical. Remote area medical.
And can you give the viewers your email subscription? Because I know you give out tons of resources with that, right? And fun oral lessons for the kids that they can use. Can you tell them where they can find you?
Okay, one more time is VIPsmiles.com/challenge. And if you go to VIPsmiles.com or letstalksmilespodcast.com, you can find the same resources, including, I have actually a guide that I'll tell you where you could get free and low-cost dental care as well on my website.
See, and this is what the people need. Thank you, Dr. Austin.
Thank you so much.
Practical tools, you give resources. We will definitely be having you back, because this, again, will help to save lives, because kids grow up to be adults.
That's
and we
right.
want them to have healthy lives. So
thank you so much for having me, Dr. Ebony.
Thank you.
Bye.
And still to come, my prescription of the week.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
Why does it feel like we're going backward? Voting rights under attack, schools stripped of funding, Black history erased. This is the Trump MAGA agenda. They want to take us back. They are redrawing congressional lines in states across the country, deciding who gets power and who gets silenced. We see what this is, a power grab. Virginians won't be fooled. Show up, vote, take back our power. It's a temporary measure that gives the people, not politicians, the final say. Vote yes by April 21st.
Let's talk about obesity, because it's often discussed as a personal failure when in reality, it's a complex medical condition. In the United States, more than 40% of adults are living with obesity, according to the CDC. That means nearly half the population is dealing with a medical condition that affects metabolism, hormones, and long-term health. Obesity isn't simply about willpower or discipline. It's influenced by genetics, environment, food availability, stress, sleep, medication, and metabolism. The body has built-in systems that regulate hunger and energy use. And when those systems become dysregulated, well, weight can increase even when someone is trying to make healthy choices. And why does this matter medically? Well, obesity is associated with an increase in risk of type 2 diabetes, heart disease, high blood pressure, sleep apnea, joint problems, and even certain cancers. It can also impact your fertility or your mental health and your overall quality of life. But here's an important point. Health improvements can happen even with the most modest weight changes. Losing just 5 to 10% of your body weight can significantly improve blood pressure. It can control blood sugars and cholesterol levels. And treatment isn't just this one size fits all, right? Some people, the lifestyle changes like improved nutrition or increased movement and better sleep, they may make a huge difference. And others may benefit from medications and treatments, including medications like GLP-1 therapies, or even bariatric surgery in certain cases. The goal should never be shame or blame. The goal is health, sustainability, and support. Because obesity isn't simply a number on the scale. It's a medical condition that deserves understanding, evidence-based treatment, and most importantly, compassion. And that, my friends, is my prescription of the week. Thank you all for watching, and we'll see you next week on Second Opinion.